Hi, I'm Kobe Woltz, and this is my ankle assessment. At first, I'd ask them some history questions, such as what their name or age was, and then I'd ask them their daily activities, such as sports or job. Maybe I'd ask them if they were sitting all day or if they were standing all day. It'd make a difference. Pretty much anything that they think would affect the injury. Then I would ask them what type of shoes they wear, such as high heels or Nike running shoes. And then I would ask them what type of area that they live in. Do they live in a hilly area where they're always walking up and down, or are they in a fairly flat place? And now I'd move to mechanism of injury, such as a specific place on his ankle that hurts. If it hurts from here to here, or if it only hurts in this one particular spot. And that is just to narrow down the possibilities of what the injury could be and to help me and the patient figure out exactly how to help and figure out what is wrong with his ankle. Now we're going to move on to the observation part of our assessment. At first I'll check for any obvious bruising or swelling. If not, I'll run a couple tests on you. Can I get you to stand on your toes for me? Anything?
Nope.
Alright, can I have you move your weight back to your heels? Anything?
Nope.
Alright, can I get you to walk for me? Just walk. Feel anything?
Nope.
Oh, it looks good. Alright. Now we're going to move to the anterior view of the ankle and foot. I'll just check for any ingrown toenails or bruises, swelling, bones sticking out, or maybe some funguses. From what I can see, this patient does not have any of those on both the anterior and the lateral side. Can I have you raise your toes for me and I'll check the resistance? Good. Can I also have you put some pressure on the table for me with your toes? That also looks good. Okay, now we will palpate the medial and lateral malleolus. Also, we will palpate the tibial nerve, checking for anything out of the norm, such as swelling or bruising. How's that feel?
Fine.
Now we will check the inferior and posterior side of the medial and lateral malleolus. How does that feel?
Fine.
Any pain?
Nope.
Good. Now we'll check the posterior side of the heel, checking the Achilles tendon for any swelling or tenderness. How does that feel?
Great.
Good. Moving to the anterior ankle, we will palpate the tibiofibular ligament and the calcaneofibular ligament for tenderness. How does that feel?
Fine.
On this side?
Great.
Great. Now we're going to check the plantar fascia for any pain or swelling. I can see that there is no swelling. How does that feel?
Fine.
Alright, now can I have you dorsiflex? Let's just check the range of motion. That looks about 20, 25 degrees. Can I get you to plantar flex for me? Looks about 40 degrees. Can I get you to invert for me? Invert. That is about 20 degrees. Can I get you to evert now? That is about 33 degrees. Alright, now I'm going to do a couple tests on them, starting with the anterior drawer test. Seems fine. Now I'll move to the talofibular ligament test. So can I get you to invert your foot for me? Alright, that seems fine too. Now I'm going to move to the valgus and varus stress test. Can I get you to lay your foot straight for me? I'm just checking for knee stability right now. Alright, now I'm going to move to the NTP stability test. Can I get you to raise up just your big toe? Now can I get you to push down? Now can I you do that with all your toes? Alright, good. Now I'm going to move to the intradigital neuroma test to make sure all the joints right here are fine. Everything seems to be fine. Alright. I'd just like to thank my guests, my camera lady, Bobby Bushnell, my dog, Bella, for helping me out with history questions, and my original patient, my dad, Mr. Ted Woltz. Thank you very much. And I'm Coach Woltz, and this is my ankle assessment.